Hey everybody, we're going to go over Chapter 16, Heparin Administration. If you all want to open your textbooks, you can follow along with me, or maybe even open your PowerPoints. Perhaps you can see them a little better from your computers. We're going to explain a little bit about heparin, the process of heparin administration, the difference between the low molecular and the unfractionated, some of the lab tests that are used, as well as sub-Q and IV administration of the heparin. Whoops, that would help if you could see those. We're also going to be learning how to calculate the milliliter per hour flow rate for continuous infusion, as well as calculating the units per hour for continuous infusion and units per hour, milliliter per hour when a dosage, prescribed dosage gets changed. So a little bit about thrombus. Venous thrombosis occurs when you have a blood clot formation. Maybe there's injury, maybe there's surgery that was performed. Summaries are prolonged immobility. A blood clot forms and can be released into the venous system. When it's a problem is when it's considered a deep vein thrombosis. That blood clot can break off, it could go to the heart, go to the lungs, could go to the brain, causing very severe implications. Or it can lodge in small vessels and just damage the tissue around it. So many medications, anticoagulants, are prescribed to treat this. And this presentation basically focuses on some of the heparin administrations. Very, very important for nurses to know how to calculate accurate dosing of this, because that can be fatal. Fatality is in the form of bleeding, excessive bleeding, if a patient's given too much heparin. Okay, so again, it's an anticoagulant, comes from bovine lungs, which is just cow lungs, and pig intestines. And one of the drugs to treat, again, the DVT or deep vein thrombosis, and the two types are the unfractionated and the low molecular weight heparin. The difference between the two being how big the molecules are. So the molecular size, UH is a very larger size, usually given IV, whereas the other is small, typically given sub-Q. They both can be given sub-Q. Okay, but the low molecular is almost always sub-Q, except for the enoxaparin, which may be given IV under just some circumstances. Neither one can be given orally because the stomach acids will break those down. And then again, if they're given IM, you have an increased risk of a hematoma occurring. Now give me just a minute because it's harder for me to look back. And let me see if I can get this going on my computer a little bit better. Okay? Oops, sorry. All right, so heparin is supplied in vials, as you can see, in different molecular weights and units. You've got 10 units, 100, all the way up to 40,000. Low concentrations are usually just to keep IV lines open, keep them from being clotted with blood. You've probably heard of heparin locks. Okay, and this is just showing a couple of different types of labels that are used. All right, so what we're going to do when we give sub-Q heparin administration is we're going to have diluted preparations. These, again, are used to prevent blood from clotting in IV lines or central venous caths. Heparin's used for this purpose as the heparin lock flush. These come in 10-100 concentrations, and they get instilled in the catheter based on recommendations of the manufacturers, which is always on the labels included in the medications. So highly concentrated solutions, your 20 to 40,000 units per ml, are almost always given IV in IV solutions, and they're continuous infusions given in the large bag solutions. Sub-Q, these are highly concentrated heparin preps and can cause, again, excessive bleeding. So we have to be very, very careful in how we measure those as well as giving those. Joint Commission came up with, they wanted every hospital universally to have a program that met certain criteria, protocols. They are in place that have to be done every time heparin is admitted. Hopefully sometime in clinicals you all will get to be a part of those protocols. Okay, so your low molecular weight heparin is typically in pre-filled syringes, but they also can come in your multi-vial doses, and those are the ones that we want to be extra special careful that we're getting the correct dosing. The concentration is, of course, based on what the patient's diagnosis is as well as what's prescribed, and again, we always read those labels very carefully. Let's look at an example here. So a doctor prescribes 5,000 units, sub-Q Q12. Pharmacy provides a vial with a concentration of 5,000 units per milliliter. This one's going to be a little bit easy, right? So what are we looking at having to give here? Well, we need to know the milliliters. So we're going to take our milliliter units, which was given 1 milliliter per 5,000 units. The next thing given is going to be the ordered dose. Okay, and in this case, it was 5,000 units. So when you do your crossing out, that's back to a milliliter. That was pretty self-explanatory in the original order since it was already pre-given in that 5,000 unit amount. But your next one, we have ones that might not be like that. So let's look at this one. Your provider orders the 18,000 sub-Q once daily. The vial, however, comes in 20,000s. How many mils are we going to get? So let's set up our milliliters. And you have 1 milliliter per 20,000 units is the given quantity. And next is what is ordered. And when you do your crossing out and your calculations, you come up with 0.9 milliliters. Okay, let's look at a couple more here. Example 3, 120 units, sub-Q once daily, patient weighs 77 kilograms. And now we have a weight thrown in there. Okay, so the pharmacy provides this in a pre-filled syringe of 10,000. How many milliliters, and what are we going to do with our weights in this circumstance? Okay, we're still looking for milliliters. Then we're going to give our given quantities again, 1 milliliter per 10,000 units. Insert the second and third given quantities. So now we take our prescribed dose, but now we've got to calculate in our patient's weight because again, heparin is typically given by weight of the patient, and so that in this case would be very important. And so we round to the hundredths, so we have 0.92 milliliters. Okay. All right. Heparin can also be administered, of course, intravenously, as well as sub-Q. It can be given intermittently as a bolus or infused continuously. And when they might do a bolus is when you need to get a really quick blood level of heparin, thinning out that blood to prevent clotting. And so many times a bolus will be given right before a continuous infusion. Sometimes it'll be given in between if a continuous infusion is not getting that patient's level to where they want it to be. Again, most protocols are based on weight, especially with your IV administration, so it's very important that the patient be weighed before given this IV. So let's look at an example now. Before we were looking at sub-Q injections and thinking about sub-Q going into the fatty tissue right there underneath the epidermis, you're thinking of small amounts. That's why you're going to be getting these amounts in tenths and hundredths. It's going to be point something of a milliliter. Typically, a small amount like that will never be more than a mil. However, when we're talking about a bolus dose, those are still going to be somewhat smaller doses, but they're going to be more than just a sub-Q because this is going in a small amount of fluid. And the reason I'm stating those things is to help you remember if you come up with this crazy 3.5 milliliters of heparin sub-Q, way too much to be injected sub-Q, so that should trigger something in your mind to go, ooh, I better relook at that calculation. Okay, so again, IV, it can be given intermittently or a bolus, and again, most of these are based on patient's weight. Okay, provider orders heparin bolus 60 units per kilogram. We recognize right off this is going to be based on patient's weight. IV, prior to initiating a continuous infusion, the patient weighs 61 kilograms. Pharmacy provides it in a concentration of 5,000 units per meal. How many meals are we looking to give for the bolus? We're going to round this answer to a tenth. Be sure to pay attention to whether your directions are asking for tenths or hundredths. I know some of these slides even were pre-made before me, and some of them don't always round to the exact amount, but it's very important for you to pay attention to what they're asking when they ask that. Okay, so we're going to set the equation here. You've got, well, again, we're looking for milliliters. We were given the quantity of 1 milliliter per 5,000 units. Second thing you're going to do is provide the dosage. Okay, the dose was 60 units per kilogram. So now we have to have the patient's weight to plug in there. The patient weighs 61 kilograms. So when you calculate that out, we're going to round here. This is rounded to the hundredths, so direction told us the tenths. So that would be rounded to 0.7. Okay. Go ahead and look at example 2. Orders for a bolus of 80 units prior to continuous infusion. Patient weighs 96 kilograms. Pharmacy provides it in the blah blah concentration. Let's keep looking. Okay, so how do we set this up? Okay, again, we want our milliliters per our given units. Then we're going to set up what our dosage is going to be, and then we're going to need our weight. So this is a 3-step process. Once you cross that out, you're going to have 0.77 should be 0.8 milliliters if you're rounding to the tenths. Okay? Okay. So now let's look at continuous heparin flow rates. Continuous, meaning the heparin that you're going to calculate for these dosing is going to go in an IV solution bag. It's going to be put on a machine. It's going to run continuously. So you would expect to probably get more than tenths on this. So again, I'm saying that just to help you remember when you go to calculate these things, that should click in your head. Okay, it's sub-Q, it's a small amount. Oh, it's for the intermittent, it's a little bit bigger amount. Oh, it's for the continuous. It's going to be a little bit even more amounts that get calculated. Okay. Let's see, I'm a little bit behind here. Okay, so every facility, like I've mentioned before, should have some kind of a protocol in place regarding heparin. Very important in these protocols, first of all, what lab tests are needed before and after heparin is given. What is the bolus or loading dose that's given prior to the continuous infusion? What is going to be the infusion rate? And the type and frequency of lab testing during the infusion. They're going to be taking those PTTs to find out how the patient's blood is responding to the heparin administration. So, and there should be very clear directions for how to adjust if the laboratory values are out of the standard or what the doctor is looking for. Clear orders should be in place there on how to make those adjustments. Okay, and you're going to want to document that as well. This is just showing a protocol, but there is a place in your book that kind of shows documentation. I think that's further along in here as well. When we're looking at continuous flow rates, it's available in all these different mixed solutions. And because there's so many different solutions, pharmacies typically prefer just to pre-purchase ones that have already been pre-mixed instead of making them themselves. Okay. Heparin must be infused using an infusion pump. This is not something that we would want to try and sit there and calculate the drips per minute. Infusion pumps can monitor it in both milliliters per hour as well as units per hour. We still need to know how to do the calculation so that we can verify if it's correct. As we all know, machines are wonderful, but we can't fully depend on them for everything. We should still know how to correctly measure those. So most facilities utilize some kind of heparin flow sheet for staff to keep a track of for changes in those solutions. Your book shows that flow sheet on page, I think it is, yeah, 336. You can look on 336, kind of get an idea what those flow sheets look like. Those typically are in our electronic medical record systems now, so it would look still the same way. You would just be entering it into the computer versus possibly writing it out on paper. Okay, so let's look at our problem. Doing a continuous flow rate. Provider orders continuous heparin to begin at 15 units per kilogram per hour. Good sign, you gotta have that weight. Patient's weights given. Pharmacy supplies heparin in a premixed bag, blah, blah. Calculate the milliliter per hour flow rate. So again, we're looking for milliliters per hour, okay? And so our equation given told us that we had 500 milliliters per 25,000 units. I think you guys are familiar with this now, but always, always on the top, this has got to equal up if you want the rest